it's all saying we don't like going to the dentist, so I thought I'd bring the dentist here. This is Dr. Jay Feuillerat. He's the dentist now at Scenic Bluffs Dental. Amy Sue Holt is his assistant, and he's just hired another assistant as well. Jay is from Detroit Lakes, Minnesota. We did a profile of him in the journal. He's a graduate from the University of Minnesota Duluth and dental school in the Twin Cities. He did a practice up in Stillwater, and now he's established himself here in Prescott, and he's going to talk about his work there and dentistry in general. So without further ado,
All right, well, I'll get started here with just a little outline of what I'm going to talk about. It's nothing too crazy or in-depth, but I'm going to start off with just talking a little bit about myself. Sean already touched base on a couple of things, but I'll add to that a little bit. And then I'm going to cover two main topics. One of them is just in general how dentistry is improving, a couple of the major advancements that make it more fun for us at the clinic to do dentistry, but also make it more comfortable and I don't want to say enjoyable, but tolerable for patients to come in and get their dental treatment done. And the second main topic is the oral systemic connection, which is a real fancy term of just relating the oral health to the full systemic body health and showing how it can and does contribute to overall health, and in some cases making some of the most common conditions like heart disease and diabetes and just even high blood pressure worse versus not having the disease. And then we'll have some time for questions at the end. So here I put a little map together showing my migration down to Wisconsin. I started off, I was originally, when I was really small, living in a farm community in northwestern Minnesota called Argyle. There's about 600 people who live there. And on both sides of my family, I come from a long line of crop farmers. And then due to a couple deaths of the men in my family, I got a little pivot into dentistry rather than becoming a crop farmer. Then I moved down to Detroit Lakes, where I lived there from grade school until I graduated high school. And then I moved over to the east side of the state for Duluth, where I studied biology and chemistry, more so because those degrees lined up the best with the prereqs for dental school. And then I came down to Minneapolis. So I graduated in 2017, and then my significant other, Sam, and I, we were both in the same dental school class, and we both found jobs over this direction, so we moved to Hudson. And that's where I still currently am living, but I do want to move down this way, be closer to work, and just, I want to be out of the city. So in my free time, I like to, my main hobby is hunting. I like hunting, but you can only really do it for a couple months out of the year. So now that it's almost September, I'm getting really excited to spend a lot of my time doing that. And then in the winter months, that's a picture of my sister and I snowboarding. She's a dental hygienist and she lives out in Colorado. So I go visit her every chance I can. And then on the bottom there is just a couple weekend trips or trips around the U.S. that I like to take with Sam, my girlfriend. And then I know it sounds a little bit nerdy, but I am part of a study club where we learn about dentistry and further our dental skills, really. And that's the group of us in the bottom right on our trip to Arizona in the winter to go visit the facility of Spear. Okay, so I get this question a lot of how I ended up in Prescott, because I'm not from here and everyone expects that I would be from here if I was going to come back and start a dental clinic. But it really was just, I was living in Hudson and I spent about the year and a half out of school really looking for an existing dental clinic to buy or to be part of and transition into, and where I kind of wanted to settle down for the next 30 to 35 years of my career. Because I just didn't see that happening where I was at the time. And I really did a pretty exhaustive search and I wasn't able to find any any clinics that really were set up for what I wanted to, or how I wanted to practice dentistry. It was a lot of the ones that were available. It was more of a fixer-upper type of deal, and I just kind of wanted to start off on the right foot and get everything in place. So I decided to take that as an opportunity to just build a practice from scratch. And through a little demographic research to make sure that Prescott could handle another dentist, I decided to dive in. And so here it is, a couple pictures of the process. Now, it was about this time last year when I finally got everything in place and executed the lease at the building right kitty corner to this building. And that's when it started with the whole design process and getting permits to build, which took quite a while through the state. So actually, from last September all the way until February, we were waiting around to just tear down what was there currently and then start building. But then once we started, it only took about 2.5 months, and we were able to get the clinic fully built by middle of May, and then open for business on June 10th. And like I said, that was when just Amy and I were there. So as far as the dentistry part of it, what's changing is nowadays, due to a lot of advancements, we're being able to see problems a lot sooner, which allows us to be more proactive with dentistry rather than just waiting around until problems are so big that it's just a clear, cavity or broken tooth. We just drill and fill, patch things up, and send people on their way. And what we're trying to do is prevent the problems in the first place or catch them a lot sooner. And that has to do with a lot of the materials that are being developed, because the old silver fillings, they don't really bond to the teeth. So it was a lot of times it would be taking out a lot of excess tooth structure and kind of weakening the teeth and not setting them up for a long-term health status. So now it's just more focused around prevention. So here is a couple examples of some intraoral photos on the top there. Now, these are really helpful with aiding in diagnosis. It's really hard to see teeth sometimes when it's in the back of the mouth and they're real dark. So if we can snap a fully lit picture and pull it up on a screen where we can see stuff like this crack, or we can illuminate them, it helps us not pass over some problems that may be growing and put us in a tougher position if the tooth does break. It also really helps with communicating with patients and being able to show them what's really going on. And that goes back to the being more proactive about dentistry and being able to show people what's actually happening rather than waiting till it hurts or waiting till something breaks to really tackle it, because that's usually when things just get more involved and you have to spend more time in the chair, and you also have to usually spend more money to fix a tooth that's more broken down. And on the bottom here, I'm sure everyone knows what that is when you get the x-ray sensors in the mouth. But at our practice, we have an x-ray machine that we actually don't have to routinely take these images, so we don't have to put the digital sensor or the cardboard sensor or anything in the mouth, and patients really, really love that. And dentistry's really had to advance because people are keeping their teeth longer. Nowadays, the average between men and women, the average lifespan is about 79 years old, whereas just 75 years ago, people lived to an average of 50 to 55. So that just means that we're seeing a lot more people who want to keep their teeth into old age and not just have them extracted and get dentures. So we've had to come up with approaches to really help out and prevent the breakdown and loss of teeth. And then here's a systemic connection that I was talking about. And the big thing here is periodontal or gum disease and how that relates to the systemic connection. Now, this picture on the right here is showing an example of a periodontally involved tooth, or the gums. So the periodontium is just the attachment of the bone and the ligaments to the teeth. So on the left here, this is a healthy gum. Generally has about this is the pockets we measure, and usually this area around the tooth is about 2 to 3 millimeters deep. And that allows a toothbrush to clean out those pockets really well and floss, and you can do that at home and keep the gum healthy and keep the inflammation to a minimum. Whereas on the right side, now if you get over 4 millimeters deep in this pocket, or even more, the toothbrush can't reach down here. So, you can imagine if you never brushed your teeth, how bad they would get above the gums. But in these areas, you can't brush them either. So what happens is, if these aren't treated properly with deeper cleanings, essentially plaque and bacteria just sit down in the depth of those pockets and just harbor the inflammatory response. And the bacteria there just kind of seep through those gums, the inflamed gums, into the bloodstream. And that's where this book here, Dr. Bradley Bale, he's actually a family practice physician, but he was the first one to realize that a lot of the bacteria from the gums was seeping into the bloodstream and showing up in places like the sclerotic plaques in the arteries of people with, coronary artery disease. And also they were in the blood clots that would form when those plaques would dislodge and cause heart attacks or strokes. Because generally the plaques aren't what break away from the artery for heart attacks and strokes. It's more so those tear off a little bit and form blood clots that then get sent down. But Bradley Bale, through some of his research, he was seeing that in some of these plaques and also the blood clots, there was bacteria that should only be found in the mouth, based on testing of healthy people. So that really triggered the response from the dental community to really inform their patients that the gum disease isn't just causing the bone to disintegrate around teeth, but it's more so it's for the systemic health to try lower that inflammatory load in the bloodstream, which shows up in other areas. And then another real hot topic in dentistry right now is airway, and that's more so because there's just an epidemic of sleep apnea now showing up that it might have been around for quite a while, but now it's really being addressed both at the regular physician and normal checkups. People are really screening for this, and knowing that just snoring might be something more like restricted airways throughout the evening. And then here with the kids, I have a picture of an example of underdeveloped or real narrow arch. Now this has some added effect of some crooked front teeth as well. But it is pretty common for kids in development to, even if their front teeth are straight, to have this really high arched vaulted palate, which kind of robs space from the sinuses, and then also doesn't allow any room for the tongue to go. So then these kids are getting sleep apnea, and or they're kind of relying on mouth breathing because they can't breathe through their nose, and then that just further inhibits the growth and development of the jaws. So the largest thing with kids is orthodontics and helping the jaws develop properly, and also eliminating mouth breathing. Just because it's been shown that mouth breathers, their brains don't, in kids, their brains don't develop quite as fast. It's one more thing working against them if they're not getting proper oxygen, both when they're sleeping but also through the day. And then in adults, you can use orthodontics as well, but when your jaws aren't growing anymore, it's a lot harder to manipulate it. So then a lot of times, if someone has sleep apnea where they have constricted jaws and they have a really large tongue and they don't have enough room for air to get through, especially once they sleep and all those muscles start to relax, we use things like the CPAP machine, which is the gold standard. So if anyone had sleep apnea, my first recommendation would be to use a CPAP machine, because that has been proven to be the best, and it literally forces air by all those obstructions, whether it be the tongue or constricted jaws or both of them when you're sleeping. But a lot of people don't use those long term, or they're not compliant with CPAP machines long term. One, because they're a little uncomfortable on the face when you're sleeping, but also it is just kind of an obstruction in itself. But the second best thing would be the sleep appliances. And what these do are it's like two mouth guards. And there's a lot of different designs, but they kind of force the lower jaw forward while you sleep to help open up the airway. So when the tongue muscles and the throat muscles do relax when you sleep, there is still space for air to get by without that obstructive snore, or without straining your body too much. And these show they have quite a bit higher compliance, just because they're easier to wear. And then when you're traveling and stuff as well, it's easier to put this in your suitcase rather than your big CPAP machine. So there. And those are really all I had to talk about. So I'll open up for questions and we can go from there.
Dr. G,
Yeah.
in children, do you use a palate expander?
Yep. So that was
something like that to help?
Yep. That's kind of how you would get from the left side to the right side. Would be palatal expansion, because with kids, like I said, they're developing. So until you're about 14 or 15, the palate is not fully developed. So that's why you're able to put in the appliance and kind of use a key to spread them apart, just on the right and left. And then once you get those to a good width, then you can bring the front teeth in and develop it that way.
How does TMJ disease and bruxism work with or against sleep apnea?
A lot of it is they find is from sleep apnea. Sleep apnea can trigger it, because when you're kind of fighting for air through the night, that they say that can lead to kind of parafunctional habits where you're grinding. And but as far as the TMJ and the grinding itself, if we're going to make a grinding appliance or a TMJ appliance, those are all full coverage appliances that, one, keep the teeth apart so you can't damage the teeth, but also with this one, the lower jaw would be protruded. So with TMJ, it's a little tricky. It's kind of a trial and error type of deal to see if your joint can handle being out of the socket. But it does eliminate you grinding right to left and doing damage to the joint that way with bruxism. But it's kind of all based on the health of the joint up there and kind of how long bruxism has been an issue, and if we've kind of ground away the disc up there, because there's a disc in between the bones.
Other than dentures not fitting properly, how are tori? My daughter just said, "Thanks, Mom. Now I'm getting them."
Yeah, I got them too.
And some people what?
On the bottom. So those do come from grinding. But if you're not trying to wear a denture over them, and they're not so large that they're...
Well, I was told if I ever needed dentures, I'd have to have oral surgery because of those.
Yeah.
Even in the roof of my mouth, I've got one.
Mm-hmm.
And it's...
Yeah, and the thing with those is, they can grow back as well. So lucky you.
I've never heard of them, so yeah, it's a bony structure.
Mm-hmm.
How did you, how many dental offices now are there in Prescott? Are they just two?
There are two now.
Yeah.
Yep, there's two offices and 3 dentists.
Yeah. So in your research to try to find a place that probably a population this size could in fact support another dentist, is that what you found? And what made you decide on Prescott?
That was part of it, definitely. Because whenever you open up a clinic from scratch, you need an abundance of patients, or at least maybe not an abundance, but you need a population that can support it. So I did research as far as the population of Prescott and the surrounding area, and also kind of how many dentists were here. And I actually worked with a company for that to rate a couple different areas around, but it was Prescott and Hastings. This whole area seemed like it could really support another dentist, so I decided to be on the Wisconsin side.
Yeah.
And also, this is a little closer to what my hometown is like in Detroit Lakes. It's a smaller community where you recognize people around town, and that's kind of what I wanted to.
Now, how about Sam? Did she finish dental school?
Mm-hmm.
Is she a dentist for?
Yeah, so she is in Hudson right now.
Oh, she is.
But yeah, we're not sure exactly long term, but if it supports down here, she might even transition down here eventually.
And you have in your office yourself and do you have a hygienist or a?
No, I'm doing the hygiene right now.
Okay.
But I do have me, and then Amy is working at the front desk there.
Okay.
And then I have one assistant right now. But we are getting a second assistant at the end of September.
And you opened up in
June 10th.
Is it going okay? And is your kind of
Yeah.
mapping out? You think it's good?
Yeah, I think some days we're even a little bit too busy at times, right?
Okay, well, that's good news. Glad about that.
Uh-huh.
Do you work closely with any endodontists or other, because dentists can do things to a certain
Yep,
point, and then you need
exactly.
like root canals and things.
Yeah, so I do most of my own root canals, and that's one thing that the clinic I worked at before was pretty heavy on the emergency side, whereas we had a lot of openings where people could call in same day, and so I did a lot of root canals and a lot of extractions and oral surgery, so I'm pretty comfortable with those, which a lot of dentists don't get a lot of experience with. If you come right out of school and you just are focused on the restorative of fillings and crowns and all that, so it's really easy to get busy with that and then, kind of forget how to do all the other stuff. So I'm pretty comfortable with root canals and extractions, but I do work with an endodontist. I've been in contact, Grove Endodontics in Cottage Grove, or I can refer up to Hudson as well.
You mentioned something about old fillings, and I can remember as a kid, big fillings being put in, and then those had to be replaced with crowns because there's not enough tooth left to do anything with. So
Yeah,
there's
or
a
if
difference in how you treat cavities now?
Yeah, because those silver fillings, I'm gonna have pictures of them here. The silver fillings, they don't bond to the tooth. So a lot of times they had to take away a little extra tooth structure to kind of design the preparation in a way that would hold the filling in. But in this instance, this tooth is cracked, which is pretty common with the old silver fillings because if they're wide enough, they kind of just act like a wood splitter, is the analogy I use, because if you're biting on it and the tooth is holding the filling in place, eventually the tooth starts getting tired from the little micro movements, and then we start seeing these cracks develop. Whereas nowadays, because our fillings bond to the tooth, a lot of times we can keep the preparation just to the area with the cavity. So if this had
So what kind of material is it? It's filling.
it's a resin composite is the primary filling material we use. But then we're going to go in and take out just the area that's affected and fill it up, and then they just tend to last a lot longer because with a filling or a crown, whatever restorative procedure it is, the more of your natural tooth that we save, just the better long-term prognosis is, because the tooth is being less, it's being less abused.
I retired from public health and I volunteer at the free clinic, and dental care is like the thing. Low-income families just ignore their teeth. They just, there's no dental insurance, there's nothing. What do you see is happening in the dental world to help all of these people that need care and don't get it? Is there anything?
So with a lot of public health things have been done, and that's kind of the main push for fluoride in the water was more of a public health
But that's been around for a long time.
And that's been around for a long time, but actually some cities still don't have it though. Around, and some people are getting rid of it too, which is kind of a concern because it's not so much the well-off. A lot of times it's the well-off families who are, have the resources and they're trying to get the fluoride out of the water, but it's the kids who maybe their parents are working multiple jobs and they have a lot of snack foods, and those are the kids who really need the fluoride to help.
Nobody's reminding them to brush their teeth twice
and no
a
one
day.
exactly. So I think when we're removing fluoride from the water, it's really hurting those kids that need it most, whereas the other people could maybe get some sort of filtration system to get it out of the water. But I think
within the school system.
I think in the schools, the biggest thing would be the sealants. I know they do sealant and fluoride treatments as well in some schools, especially for the lower income families. But I would like to see just the state insurance get to a point where the clinics where regular clinics can support it, because there are very few clinics that can run off kind of a state insurance model, but it's a lot of seeing 80 people in one day, and it's not a lot of customer service.
I guess that's what I've been told with Badger Care, that a lot of dentists don't accept it.
Yeah, or if they kind of met them in the middle, but it's kind of hard to, a lot of times if you're at a clinic like ours, if it costs us, $37 to do this filling, and we're getting $37, or sometimes even less, it costs more to do the treatment, it's almost more beneficial for us to have some sort of free dental day and do kind of a charity event, which is something I'm considering for the future. Maybe a time or two a year have a day where people who really could benefit from it maybe get an extraction or a filling, or especially kids, get those things taken care of. Yeah.
Jay?
Yeah.
Question for you. Okay, so my husband had a hip replacement, and now whenever he goes to the dentist, and gets a procedure done, he has to take an antibiotic.
Yeah, the pre-med.
Why?
And that's more so on the orthopedic surgery side of things. It was very common if you got a joint replacement, more than 10 years ago, I'd say, they'd say you have to be on a pre-med for every time you go to the dental office for the rest of your life, you need antibiotics. And then in the last 10 years or so, it's shifted a lot more that they say it doesn't really do much to prevent, because what they're afraid of is us cleaning the teeth or doing any sort of dental treatment that would get bacteria in the bloodstream, kind of in that similar through the gums, like the gum disease kind of gets it through. So they're worried about bacteria getting in the bloodstream and then ending up at the artificial joint, whether it be a hip, knee, whatever. So they thought if you did pre-med, then there's less likely that the bacteria will do anything harmful when it's in the bloodstream. But they're finding that it doesn't really have that much evidence behind it that it's good long term. So now most joint replacements, they'll recommend it for 2 years, and then after 2 years they'll say you can start, or you can stop using the pre-med. And some orthopedic surgeons don't do it at all anymore. But it's more so to cover your butt, because you don't want someone's knee or hip to get infected, of course.
Right.
Yeah. So it's better to be safe than sorry.
Perfect.
Yeah.
Anyone else?
How about equipment? I know dental equipment is frightfully expensive, so I suppose when you're setting up an office, did you have to buy all new dental equipment, or
I did, yeah.
send the patients?
It was like a shopping spree for all things dental.
Well, we wish you well then.
Yeah, well, thank you. I appreciate it. All right, any other questions?
Well, thanks for your
All
time.
right.